your kingdom. Now bless the food that we're about to partake in. Let it nourish and strengthen our bodies, and the strength that we gain from it, let us return it to you in service. In Jesus' name, amen. Amen. Start what we tried to do the last time. If you will start from this end, we can make a double line, but if we can, let's swing the line back around this way so that those that may be coming in, we won't block the pathway and everybody can just start that way and move forward this way. All right, God bless you. Let's eat.
I'm going to introduce our speaker, the Reverend Dr. Bobby Baker from Warner Valley, Mississippi, a graduate of Jackson State and Memphis Theological Seminary, the pastor of Divine Faith Baptist Church, the husband of Vivian, and the father of Whitney and Gabrielle. All right. And yeah, that's the big thing right there. Okay. Also, he is the director of community partnerships for Methodist Hospital, and he's going to be presenting on the Congregational Health Network. I now present to you the Reverend Dr. Bobby G. Baker.
All right, thanks, Russell. Good afternoon.
Good afternoon.
Let me certainly say thank you for having me and giving me the opportunity to come and speak with you all today. I know some of you are familiar with the Congregational Health Network. Some of you may not be. But I'm just delighted to have the opportunity to come and share with you, try and give you just an overview of what the network is, what it does, and why it works. So we'll do that. If you don't mind, I'm not going to turn my back to you, but I would like to do this, if you don't mind. All right. The Congregational Health Network is a partnership, and it's a partnership between Methodist Healthcare, community agencies, and congregations. And if you'll move to the next slide. Congregational Health Network is an asset-based, faith-centered program that provides social support interventions to improve health outcomes. Now, let me say a word about that. Here in Memphis, we hear a lot about what we don't have and very little about what we do have. And what we know is there are people in this community who are doing amazing work. Oftentimes, a lot of it is siloed. There are people working and doing just amazing work, but it's siloed over here and it's siloed over there. So what we do is we look at the assets of a community, and then we figure out how to connect those assets so that we can bring resources to bear on issues in the community. That's really in a nutshell what we're about. Now, we define health very broadly. It says our goal is to elevate the level of health in the community. We define health from the social side of health as well as the clinical side of health. Next slide. The thing that we want to do is we want to enhance and leverage congregational strengths. We all know that congregations have strengths that are built into them simply by means of being a congregation. So these are congregational strengths that we try to enhance and leverage so that we can connect them to community entities and agencies to intervene in community health. All right, next slide. World Health Organization says that these are the things that are necessary for health. Now, what we understand is there's no one agency or entity in the community that does all those things by itself. Not one. So that means that health cannot be provided, enhanced, supported, or even really strengthened by one particular community agency or entity. So it takes partnerships, it takes collaboration in order for the health of a community to be enhanced. Next slide. So, when you take a look at this slide, what do you see? Just anybody.
A city.
City. What do you see in the city?
A park. Ecosystem.
There's a park. There's certainly an ecosystem for sure. What else?
Hospital.
There's a hospital. All right.
People.
Shelter.
People, there's shelter, diversity. All that's in there.
Activities and things to do.
Activities, things to do.
There's an urban garden behind that bush.
Is that an urban garden?
Oh, darn, you guys really like
All right, we're going to call it an urban garden. And the reason I asked the question is because different people see that through a different lens. And all of us, none of us will see everything in that community. It depends on your perspective. Next. A hospital administrator will look at a community and see it one way. A hospital administrator might see patients. A pastor will see that community another way, hopefully as a parish. Business owner sees business opportunities. Nurse or a clinical person will see patients maybe. But what we hope to do is we hope to engage congregations in a parish approach. Now, most of our congregations are engaged in congregational approaches, and we do it quite well. Most of us, in terms of congregations, we do our congregation work and we do it well. But a local church with this field of activity is really the approach that we want to foster in terms of congregations. One of the things that, anybody recognize this? That look familiar? One of the issues that we have that's a barrier to the parish approach in congregations is most of our congregations in the city are commuter congregations. People don't live in the community that they worship in, so therefore they're disconnected from that community. In other words, if I come into a community and worship, and my children don't go to school in that community, don't play in parks in that community, I don't shop in that community, I don't walk on the sidewalks in that community, I don't use the services of the fire department, police department in that community, I'm disconnected from the community. And if I'm disconnected from the community, then my means to affect change in the community is very limited without a connection. Mm-hmm. So, what we want to do is we want to create connections. Because one of the things that happens in our city is people suffer, and I don't want to make it biblical. People suffer for the lack of knowledge, but it's a lack of a connective knowledge. There are resources out there that people don't know how, they don't access because they don't know how to get to them. People don't access them because there are barriers to access. So what we want to do is we want to connect these community agencies and entities together so that people don't fall through the cracks. That's what we want to do. We want to keep people from falling through the cracks due to a lack of connectivity. All right? Now, you say, well, when has a faith-based approach collaborated with a clinical approach and made a difference? When does that happen? It happened years ago. John Snow, known as the father of epidemiology. Henry Whitehead happened to be a community pastor. There was a cholera outbreak in London in 1854. Henry Whitehead was the clinician on that cholera outbreak. Well, Henry Whitehead gets the credit for tracking that cholera outbreak all the way back to the Broad Street pump where everybody was getting their water. But what people don't recognize a lot of times is that, well, John Snow was responsible, gets the credit for it, but Henry Whitehead was the pastor who actually did the legwork, because he knew the people in the community, the people trusted him, he knew who had been sick, he knew when they got sick. So he was in the community finding out the information, getting it to John Whitehead to to John Snow, and Snow was able to track people who got sick, when they got sick, how long they had been sick, when people died, and he was able to track it all the way back to the source. And that was simply because the pastoral intelligence about that community was such that allowed him to do that. Snow could not have done it by himself because he didn't have the relationships with the community. And that's why the church, congregations are so important to the efforts of community health, is that congregations are connected on the ground level to people, to communities. Congregations and pastors have the trust of their members. Congregations know stuff about people in the community that there's no way a clinician or a hospital can know. For instance, we have an issue, and it's not a new issue. There are senior citizens in our community who qualify for home health, but they turn it down. They turn it down because they're afraid to let strangers in their house. Now, these senior citizens, many of them are part of a congregation. Well, what if a congregation called the home health agencies and said, hey, Aunt Susie has an appointment with you all on Tuesday. Somebody from the church is going to be there to let you in when she gets there, when the person gets there. That's something that a congregation has knowledge of, knows, and it doesn't take a lot of effort to make sure that Aunt Susie gets connected to a resource that she qualifies for, needs, and should be getting, except she's afraid to let strangers in her home. Or Aunt Susie is hard of hearing, and no matter how hard you knock on the door, she's not going to hear you. But the people who know her know that if you knock on the third window past the door near the back of the house, that she's going to hear you. And she knows that only people who knock on that window are people she knows. Then you can get in the house. But what that does is that removes a barrier that there's no way a healthcare organization can know or remove on its own. So congregations have an intelligence, congregations and pastors have a knowledge of the community that's able to connect resources to individuals in the community that otherwise would not get connected. All right? So, this is Memphis. We know Memphis, we know it well. Next slide. Memphis has a lot of stuff wrong with it. We got a lot of stuff. And probably most cities in America have a lot of this stuff. We just tend to have it more than other cities. And we know what it is. We know there's chronic disease. We know we got diabetes. We know there's cancer and suicide and homicide and all that stuff. We know we have that. The truth is, we got to figure out what else we have and start focusing on the assets instead of focusing on the liabilities. Next slide. So, we got Methodist Healthcare, 8 hospital system. We got more than 12,000 employees now. We are the largest provider of indigent care in the state. Methodist is viewed as caring about the community because we're in every part of the community. Every facet of our community, you can find a Methodist healthcare facility. We didn't shut down and leave the inner city. So this is an asset. All right, next slide. And of course, we're owned by the 3 conferences of the United Methodist Church. Our mission is aligned with the United Methodist Church, and it's faith. Because we are a faith-based institution, we're a 501c3 institution, so we treat everybody. And the truth is, because of the market share that Methodists have, if you have commercial insurance in this service area, if you got Blue Cross, if you got Cigna, if you got United Health, there's about a 50-50 chance that you're going to be a Methodist patient. So, it makes sense to us okay, since there's a 50-50 chance that everybody I run into is going to be a Methodist patient, then what I need to do is be in relationship with them before they become a Methodist patient. I want to be in their lives before they need a hospital, and I want to be in their lives after they leave the hospital. There's a way to do that, and we figured it out. Next slide. Now, most pastors, you show up at the hospital, and don't get me wrong, when I show up at the hospital, especially if I'm visiting the hospital on Sunday, I am so glad to see that sign. And I am just delighted that I show up and there is a reserved for clergy sign, and I'm also glad when the spot's empty too. But it makes me happy that, okay, they're thinking that clergy's going to be here visiting, taking care of their members. All right? But what else? What else can we do? How else can we be in partnership? Well, we identified entities in the community that we think if we bring in partnership with us and align those resources with congregations, that we'll be able to make a difference in the health of the community. Memphis Health Center, Federal Qualified Health Center, Christ Community, Church Health Center, who's here with us today, MIFA. If we connect these community entities with congregations and leverage those resources and relationships, and this is what I mean. If I can provide, and one of my pet peeves is I need a real live person. I don't know about you, but I hate dealing with phone trees. I need a person. And so one of the things is we want to have a person. When you call Christ Community, a person, somebody you're familiar with, somebody you know. I want to be able to call Gene and say, Gene, I need to talk to somebody over at Christ Community. And Gene says, hey, call this person at that number, and I call that number, and that person that Gene gave me the name actually answers the phone. That's the relationship that I want to have. And so what we want to do is we want to be in relationship, and then we want to bring congregations into that relationship. Next slide. So, I have no idea how many congregations are in our service area, but we do know there's somewhere between 2,000 and 4,000 congregations in the Methodist service area within about an hour and a half of downtown Memphis. I guess it depends on what Sunday you count, but there are a lot of them. We're in the Bible Belt, and we're probably in the buckle of the Bible Belt. So, if we got that many congregations, what if all of these forces can come together and collaborate to address the health concerns of our community? So, we decided, let's sit down and let's ask pastors. All right, pastors, we know you have knowledge and intelligence that there's no way a hospital could have. Will you sit down with us and help us create a partnership and a program that will bring us into relationship and help us better take care of your members that you take care of all the time? So, we had 12 pastors come together. We did this down in Methodist South. We sat down and we sat around the table, and none of the pastors who were on that committee are in here today, but this happened over a period of about 18 months. I know that that's not a large document, but when you got 12 pastors at the table trying to hammer out something, oftentimes it's not an easy thing to do. But they came up with a covenant agreement. Now, there's some things in that covenant, and Russell, you got some packets. All right, I've got some packets, and the covenant is in that packet. Part of the covenant just simply says, this is what Methodist agrees to do, and this is what we ask clergy to do. All right? Methodist agrees to be in partnership with congregations, to be a community health resource for congregations. Methodist also agrees that if you are one of our partner clergy members, we will give you a discount, you and your family, a discount on your health care services at Methodist Hospital. Now, you'll see it says up to a 60% discount. Even before CHN, the United Methodist clergy got a 20% discount from our hospital. So the discount is 20%. That's if you have insurance. If you are uninsured and you're one of our pastors, we will give you up to a 60% discount on our health on services from Memphis. Now, we have almost 600 congregations who are in our partnership now. That has turned out not to be a big deal for a lot of pastors, but it's something that's there for you should you need it. The other thing is there are educational opportunities that the hospital offer that we agree to offer to our partner pastors for at no charge. There are other things in there. Of course, you can read them. But we ask clergy to do a couple of things. First thing we ask you to do is appoint a liaison from your congregation, at least one. We'd like to get two, so that we can train them on our program, and they can be the connection between the hospital and your congregation through our navigators. And I'm going to tell you about navigators in just a moment. Okay, next. The reason we're looking at this is there is a journey of health that people are on. And most of the time, people are not in the hospital. Matter of fact, if you're blessed, on average, you only need a hospital once every 7 years. That's it. The rest of the time, you're in the community and you're part of your congregation. Now, why congregations? Well, we did some work, research in the emergency room, and we found that 70% of the people who present in our emergency room say they have been in the house of worship in the last 30 days. Well, think about that. If we're talking about 40,000 people, it's probably 50,000 by now, but if you're talking about 40, 50,000 emergency room visits, 70% of them were at somebody's church the previous month before they came into the hospital. Well, is there something that could have happened in the church that would have made the difference in them showing up at the emergency room? Is there something that could have happened in the church? If they showed up with a blood pressure issue, could the church have found that blood pressure issue before they got to the point they had to show up in the emergency room? Are there some things that can happen in the church when they leave the emergency room or they leave the hospital that can help them stay healthy and live a productive life with whatever's going on with them? We believe there are. So, we know that Methodist patients, when they're not in the hospital, they're in your church. That's where they are. I know when we told the covenant committee pastors this, they laughed. They thought, surely you got to be kidding. You don't believe that. Well, after we started registering people for our network, we found that 80% of the people who signed up for our network were already Methodist patients, and we got them out of the congregation. So we know that's where Methodist patients are if we are going to make a difference in their health before they need a hospital. All right? Next slide. So, Congregational Health Network consists of a director, 11 paid full-time navigators. And this always trips me up because we have different types of navigators. But I'm sure we have 8 congregational navigators who deal with congregations. Is that right? All right, so we got 8. We've got 8 full-time employees whose job it is to be in relationship with congregations here in the city. Be in relationship, be a resource for pastors and congregations. We have one navigator that's population specific. Well, we have two, but one of them deals with congregation. We have a navigator that only deals with the Latino population. That's all he does. And we have a navigator that works in the Riverview, Kansas area. That's all she does. She's not responsible for congregations. She's responsible for the community. Because, I said before, we're talking about a parish approach. Our target with the Congregational Health Network is not really just to get into a congregation. Our target is to reach the community that that congregation sits in through that congregation. To enhance capacity, to give that congregation the capacity to make a difference in the community that it sits in. That's what we're trying to do. So right now we have almost 600 congregations, covenant congregations that are active. We have more than 600 that signed the covenant, but these are the ones that we identify as being active. We have almost 700 trained liaisons in these congregations. Next slide. And we have registered as members more than 21,000 people as part of our network. Next slide. And conservatively, we know that in those 570 congregations, there are more than 200,000 people in those congregations. So we see the reach of CHN. All right, next slide. These are engagement levels, and you can see we have plotted our service area, mapping our service area, so that we show our congregations, we show what level of engagement they're involved in, and I'll go over that shortly. We build capacity in congregations by training. We believe that the more knowledge we have about the issues of health in our community, the more knowledge we have about the resources that are available in our community, the better equipped congregations are to actually address those issues in the community. Remember, this isn't about Methodists doing it. This is about Methodists equipping congregations to do it. It's about trying to enhance, create the parish approach. All right? Focus area. We believe that there are 4 areas. If we can move the needle in these 4 areas, we can elevate the level of health in this community. The elderly and advanced disease. We know what elderly is, but there are people in our community whose disease state far exceeds their age, and that's why we call them advanced disease. We know there are people in their early 20s who are in end-stage renal failure. So their disease far exceeds their health. Mental health, I think the mental health issues in this city are well chronicled. Chronic disease, we told you, chronic disease is at an epidemic level here. And infants and mothers. These are the 4 areas of health in this city that if we can move the needle in those, the level of health across the board in the community will increase. There are 5 ways we think it can be done. Number 1 is education. We try and educate on diseases. We educate on the process of being connected with community resources, prevention, intervention. That's what happens when someone has a health event that brings them into the hospital. Treatment, that's really, pastors call it treatment, but it's really access. What's available to you in the community when you have a disease condition that you're living with that will help you live a productive life. Aftercare, when somebody leaves the hospital, how can we equip congregations to be a resource in that community so that if I'm in that community and I need something, I don't know where to look for it, I know I can call the church and say, hey, I need this, can you direct me in the right direction? I want to talk a little bit, go ahead. Level 1 congregation has signed a covenant. Level 2 has liaisons, and they've been trained and they're registering members. Number 3, the congregation is participating in capacity building, making connections in that congregation. Level 4 congregation was just one who has sent us a testimony saying, hey, this works in my congregation. A level 3 is the level that we want to get all of our congregations to. And go ahead. Next slide. This is how we track congregations. Go ahead, next slide. How do you choose a liaison? Our congregation liaisons are, they don't have to be clinical people, but they do need to be someone who's well connected in your congregation, well integrated in the congregation. They need to be someone who has good communication skills, understand privacy. A lot of things that we take for granted are not acceptable anymore. For instance, it's really not proper to, unless you have permission, to stand in a prayer circle and say, Jean's having surgery for cancer tomorrow. That's not proper to do that anymore. All right? Not proper to reveal people's health information anymore. So they have to understand confidentiality, have to be able to document things. These are things we ask congregation liaisons to do. Now, our navigators take our congregation liaisons and they train them on the program. The liaisons go back and implement the program in their congregations. Next slide. We ask members to register. Now this is the thing. Once a congregation signs a covenant, they go into our database at the hospital. And in the admissions registration screen at the hospital, when you're admitted to the hospital, our admissions people will ask you, are you part of one of our partner congregations? If you say yes, they ask you what congregation. If you say, well, I don't know, what congregation you're part of. We already have all of our partner congregations in that database. All they do is punch that First Baptist Church in there on Broad Street, and boom, there it is. You're part of one of our partner congregations. Would you like us to contact your congregation, let them know you're in the hospital so they can be a part of your care while you're here? Yes, a consult goes to our navigators. Navigators come and visit you. They contact your congregation, let them know you've got a member here. And then whatever protocol that the congregation has established, we follow that protocol for those members while they're in the hospital. All right? Navigators, these are the things that they do. And the navigators do a lot of things. Because we address health from the broadest perspective, for instance, right now, y'all familiar with the WIN job training program?
Yes.
All right, WIN does a lot of training. Well, we've been getting feedback that WIN is way too difficult to get in. It's a good training program. So we sat down with the people from WIN and said, hey, let's look at what happens. What are you doing? Because we hear people saying that it's too difficult to get in. Well, guess what? WIN has 16 things you got to do to get into that job training program. 16. Now that's way too many. But they say the government requires us to have all of them. So this is what we said, okay. What if we identify congregations in the city who will be willing to be a WIN preparation site? And we'll get those liaisons and congregations together, train them on how to prepare people before they come to your office to sign up for your program. We'll make sure they already have all the documentation together. And when they show up, all you got to do is register and get them in. And people who are under-resourced, They told us it takes 3 visits now to get into WIN. Your first visit, you go, they tell you about the program, give you an application. Second visit, you go, they make sure your application is all complete. The third visit, you get accepted into WIN. If you're under-resourced, you don't have 3 visits to make to the WIN office to get into a job training program. So, as I said before, there are a lot of different issues that constitute what health is in the community, and we try and look at as many of them as we can, connect congregations with them, because congregations are a resource, and we've identified congregations as a resource. All right? This is our consultation form. Go ahead. Congregational care plan. This is a form that pastors develop, and it's just a form that if a congregation wants to use this, you can take this form, and whoever in your congregation does hospital visits, they can come and visit your member in the hospital and fill this form out, and when you leave, you'll have everything that person needs while they're in the hospital and the things that they're going to need when they're discharged from the hospital. Go ahead. Keep going. Keep going. All right? We do training to build capacity in congregations. And I'm gonna throw a little data at you. I don't want to put you in data overload, but scan on to that next. Keep going. All right. We did some analysis. After the first 25 months, we took 50 members of the network, 50 members who were patients, and we contrasted their data against non-CHN members. And this is what we found. Go ahead. We found that the length of stay was pretty much the same, but the readmissions was a lot less. Actually, the crude mortality rate, if you're a CHN member, crude mortality rate is half. That means, mortality rate means the death rate. So you're twice as likely to die from whatever you have if you're not a CHN member. Go ahead. The cost of treating those CHN members was significantly lower. Now, we could not explain the difference clinically. We believe it has to do with relationships. Because what happens is, they're staying in the hospital pretty much the same length of time, but they're not as sick when they come to the hospital. Well, what explains that? Well, the relationship. They're in relationship with us, they feel welcome, they feel comfortable coming to the hospital, and they feel like they're in partnership with us. So they feel like, okay, this is my hospital, I go when I get ready. So they come to the hospital, they're not as sick, instead of going to ICU, they go to a med-surg bed, which costs less to treat them. All right? And these are just charges per capita. A couple more. All right. These are slides comparisons we did for the span of CHN from when we started it. The admissions rate for a CHN patient is dramatically less than non-CHN patients. Matter of fact, CHN patients stay out of the hospital more than 120 days longer than non-CHN patients. Next slide. Same thing. See how I went across the board? I'll do one more data slide and we'll stop. The next thing we did was, because people asked, okay, how do you know a CHN is making a difference? So we said, hey, we'll take almost 500 people and we're going to do 2 years before they became a member of CHN and 2 years after they became a member of CHN. All right? Pre-CHN, these are the same patients. We didn't adjust for age or anything like that. Total admissions for that cohort of patients went from 159 to 101. Admissions per patient dropped from 3 to 2. Total readmits, 37 to 17. Look at the patient days, total inpatient days for this cohort of patients, almost in half. Total charges, almost half. So we have statistical data that shows being a part of CHN makes a difference to the patient, financially, physically, emotionally, and spiritually. Now, let me say this. The patient gets the same care while they're in the hospital, so there's no difference in the clinical care. What happens is it's the wraparound services provided by having social support, connection with their congregation, training, connection with community resources before they enter the hospital and after they leave the hospital. Those are the things that make a difference, because remember the earlier slide, you got about 10 things that people have to have in order to be healthy in a community. And those are the things that when we bring into connection with one another that make a difference in what happens inside the hospital. And I'm going to stop there. Questions?
Talk a little bit about the classes.
All right. We do training classes. We call it our CHN Academy. We have classes on congregational care and visitation, where we train visitation teams from congregation to do visitation in our classes. And they are that's in our packet there, you can see. But they are 7-week trainings, 2 hours a week. We do cancer training on cancer classes. We do classes on, I think we got 21 different classes. They are accredited through MCUTS and Belhaven College, so you can get college credit for them. We don't charge you anything. Yes, sir.
As far as those classes, I have a couple of ministers here in our church that we want to send through, but do they have to also? I signed the code. The other people, they have to sign up as well. They have to sign an agreement as well.
Anybody can come to class.
Okay.
Once you sign, I'm saying everybody in your congregation.
Okay.
All right. We just need your permission to participate in the program. Anybody else? Yes, sir.
I don't have a question, but just a testimony that CHN does work, because dealing with my health issues a while back with heart attack and heart surgery and everything, the quality of care that I received from the Methodist system through CHN was just outstanding. They have an excellent staff that comes up, they, checking on you on a daily basis, making sure, talking with your family, talking with your clergy people and things like that. And I just, I'm thankful for them, because it made my stay there very, very, very good.
All right. Anybody else? Yes, sir.
Is this regional like that? We're from our branch. Does it cross state lines?
Oh yeah, yeah. We've got congregations as far down as Alligator, Mississippi. We've got congregations as far east as Jackson, and we have congregations as far west as Hot Springs. I have to confess, we don't connect the way we should with those congregations that are over in Arkansas, because we no longer have a facility there. But we do hold classes in West Memphis for those congregations who want to participate. Anybody else?
Is the discount for services available to any clergy on staff at the church, or only the senior pastor?
Okay, it's the senior pastor and clergy who are have full-time employment with the church. There's a staff ministers covenant that we ask you to sign. Yes.
I think there are 4 categories of training, and mental health was one. Does that include like behavioral health or addiction? Do you have anything?
Yeah, we teach teach a course called Mental Health First Aid. Well, I started to say nationally recognized curriculum, but it's actually a worldwide curriculum. I think it started in Australia, I believe. But it's a curriculum that trains people how to identify someone who has emotional issues or addiction, how to have a conversation with them, and how to walk with them to the community resources that are available for them. And that's my question over here. All right.
I have a quick, I know
Sure.
Pastor Terry is about to come up. I invited you because I've enjoyed the relationship with Memphis, period. You guys do a wonderful job in just helping clergy. And I'm so thankful for Russell and Gene and everybody.
Mm-hmm.
But I also know that there are resources that you team up with,
Mm-hmm.
which is what I love, partnership. Partnership with the Church Health Center.
Mm-hmm.
Church Health Center has colleagues here from the Memphis.
Yeah.
When I was without insurance, the Memphis plan was an awesome thing.
Yeah.
I could pay $120 a month. I believe I had the best mental treatment, medical treatment and dental treatment that was available.
Mm-hmm.
And in fact, when we got insurance, I didn't want to get off the plane. Kind of wish I had. It was better than what we have now with Blue Cross Blue Shield.
Mm-hmm.
But I want Kylie to kind of talk a little bit because some people don't know about that. The Church Health Center had a program where pastors could come in for a whole year. And a lot of us did extremely well on that type of a program. There are resources that are available that can just help.
Yeah.
So, and you're teaming with those kind of folks. And I just want to salute you. Give God some praise for you guys and what you're doing. Thank you for kind of working in.
Yes, sir. That was fun. Thank you so much.
Thank you, Doc.
I find it interesting. Normally, my time is to get up and do announcements. We didn't have many announcements to come forward. I know we do have Church Health Center here, and that was one of the things that I was hoping to be able to do to give them an opportunity, because we're talking about resources that are available not only to pastors but to congregations. Before I asked Sterling to come up, I was in the hospital back in April, and all of a sudden I look up at the door and there's someone that walks in, starts talking to me about the Congregational Health Network. And you know, we've been members of the network, but as far as the benefits that are available to pastors as well as the staff, because I'm not the senior pastor, Pastor Dan is, but I am a paid staff member at the church. And when I realized what was available to me, I mean, it was just such a blessing. You know, being in the hospital, dealing with the issues that I was in there for, and then hearing that there's this entity that's available to help me and to help my family out, to help us with the expenses, and also to check on our care. I believe I got really, really good quality health care, and I think a part of the reason was because these people were looking out for me, as well as the staff looking out for me, as well as the congregation looking out for me. So, you know, I was hoping that we could get this segment done at some point in the very near future, because I wanted the other pastors to hear about what a wonderful resource it is. And I know a lot of times as pastors we're busy, we have a lot of things going on, people are pulling from all directions, but this is one that you may want to take some time to check out, because it's one of those deals that you don't really understand how important it is until you're in a position and you need it. And you don't want to wait until you need it to get it. Take care of it in advance, because not only is it beneficial for you, but it can be beneficial to those people that you serve. And we're all in the business of blessing the people, right? Amen. And this is really a blessing to the people. If you don't mind, would you mind mentioning some of the things that are available with the Church Health Center? And we have a representative from Memphis Plan as well?
Yes.
Good, good.
What you know, you guys team up?
Good afternoon. You all see me every month. I'm Sterling McNeil with the Church Health Center. I work in faith community outreach. It's one of the ministries that we have. And Colleen Bounds, she's a marketing rep, and she works in Memphis Plan. Memphis Plan is a part of our medical ministry at Church Health Center. My job, work with congregations. We help to develop, help to work with congregations to develop health ministries in your places of worship, designed so it reflects your congregation. And we partner up a lot of congregations, well, a lot of organizations around the city to, in a social way, to help bring, to increase the health of the congregants. So that's one reason why I bring you flyers of programs that we have with Church Health Center, but also with other organizations are doing, so that you can take advantage of and participate in. And to the forum, we have some flyers. We have things going on that are coming up over the next month and a half. It's a way just to keep you informed. And my specific role is in men's health and also with pastors. I work with a lot of pastors. In June, beginning next Tuesday, we will have our farmers market again. We'll start up again. So it'll go every Tuesday from June through October. And that will be at our wellness facility out in the, right outside the parking lot there from 10 to 2. We work with Healthy Shelby on hypertension, well, at least the part I play in is regarding hypertension in African American men. And we have a Men in Motion event that's going to be at First Baptist Church on Broad Avenue on June 6th. Lionel Hollins is the spokesperson for that campaign, and he will be there. So we have a flyer for that. Also, we have our 8th annual Men's Health Summit. This is Church Health Center program that will be on June 27th. That's the last Saturday of the month. And that will be from 8 to 12:30 at our wellness facility on Union. And then also, let's see what's the last one that we have here. Bishop William Young with the Healing Center. He has his biannual Suicide and the Black Church Conference that will be this year, June 17th and 18th at UT. So we have flyers for all of these events that are coming up over the next month, 45 days. And also our Congregational Health Promoter class, where you can send people to learn how to start health ministries in your congregations and get connected with us. The next class will begin in September, the first Tuesday in September, and it's an 8-week class. It is totally free. We will not have a summer class this year, so the next class will begin in the fall. So that's one way that we can keep connected with you and provide the services that you need and have that connection so that we can all be healthy. And Collie is going to tell you about the Memphis plan. She can tell you a whole lot more than I can about it and answer questions even better. Collie Bounds.
Thank you. All right. So I'm sure that everybody's heard of the Church Health Center. But before I was introduced, the Memphis plan was even brought up today. How many people have heard about the Memphis plan? A couple. All right. Okay. The Memphis plan is a ministry of the Church Health Centers. We are the basic, kind of what you would consider health insurance for those that are employed or self-employed. Those are the only requirements to be on the Memphis plan. You do have to be employed or self-employed. We cover everyone. We have clinics down in Mississippi. We have clinics in Tennessee. Unlike the Church Health Center, where it's sliding scale based on your income and you have to reside in Shelby County, the Memphis plan is a little bit differently. As long as your place of employment is in Tennessee or has a Tennessee billing zip code, then you qualify for the plan. The plan is basically like a 1980s HMO. What we do is we assign our individuals to a primary care physician. We have roughly 300 primary care physicians out in the community from all over. As far south as Senatobia to Millington, Lakeland practices, general practitioners, individuals. So we assign our participants to those doctors based on their zip code. So we do try to get them as close to their home as possible. We also assign them to 2 hospitals. We use Methodist, thank you very much, and St. Francis on Park. Our specialists we have all over the city as well. The way that works is your primary care physician is going to call in a referral to our office. We then find someone in our specialist network that will donate, and we'll send you to that specialist. So let's say you make an appointment with your primary care physician, you're kind of having some chest pains, they call our office. We set you up with Sutherland Cardiology, which is one of the best cardiology clinics in the city. You go out there, they'll do an EKG, a stress test, blood work. If they find something wrong, they send you to the hospital. They do a cardiac cath. If something is still wrong and you need open heart surgery, you're looking at a pretty big bill by the time you've added in your primary care office visit, your specialist visit, all the diagnostic testing, and then the surgery and the recovery in the hospital. On the Memphis plan, you're only going to pay $5. Period. That's it. There's no deductible. You're not going to pay anything other than that $5 copay. Everything's included with the Memphis plan. It's $50 a month for the first individual, and then $25 for each dependent. All of our children are assigned to Le Bonheur Hospital and their own pediatrician. It does max out at $125. So let's say you're an individual that has a spouse and 10 kids, which I've come across. It's only going to cost you $125 a month to cover your entire family.
Wow.
Yeah, it's a pretty amazing program. We also have the dental clinic at the Church Health Center. That's going to be a $10 copay for all services. And then major dental work, cavities, fillings, that type of thing, are $25. You also have access to the vision clinic at the Church Health Center. Glasses, eye exams, all of that is included. The wellness facility is another kind of perk with the Memphis plan. It's located on Union. I'm not sure, hopefully y'all have all seen it or at least heard about it. It's a full gym on the inside, cardio equipment, indoor walking track, basketball courts, indoor swimming pool that offer water Zumba. I mean, how great is that? I can see all of y'all right now in water Zumba classes. Cooking classes, diabetes resource classes, smoking cessation classes, all that's included with the Memphis plan. Church Health Center Wellness is an additional fee. It's $15 per individual, $21 for a family, which is pretty amazing in itself. The reason why I'm here, there's no reason in the world why every congregation should not be familiar with the Memphis plan. There are too many people in the city that are uninsured. There are too many people in the city that don't have access to quality care. Congregations, churches that have facility staff, front desk staff, people that work part-time, people that work in a daycare within the church. They should all have access to us. Congregation members should have access to us. There's just not a lot of people that know about our program. All of y'all heard about the Church Health Center. You proved that. Only about a fifth of you knew about the Memphis plan.
I have a question.
Yes.
Who qualifies for this plan?
As long as you're employed or self-employed, you're under the age of 65, because you do qualify for Medicare once you're 65, and you fit within the income criteria. That's the only judging mark, really. It's 200% above the poverty line, so a family of one is going to be right at $24,000 a year, adjusted gross. But we do try to work with people. Our goal is not to keep people from the Memphis plan or from having access to care. And that's it.
So it is income-based, right? So
It is income-based, yes. Yes.
Are you saying that the 200% above $24,000 a year, is that the poverty line?
200% above the poverty line is going to be $24,000 a year for a family of one.
Oh,
And it goes up, I think it's 30, 37, and 44,000. But they would qualify for the Memphis plan. We used to be an employer-sponsored program, which meant that your employer actually had to sign individuals up on the plan and sign the contract. Now, when the ACA did the employer mandate, we had a lot of people that were coming to us that did not want to go with standardized insurance. They wanted to stay with the Memphis plan. So we do Memphis Plan Direct. And you just have to come into our office or contact me, show proof of income, and then we sign you up directly. Yes.
Who pays for this?
Methodist donates their services to us. So we're very fortunate. Of course, the individuals will pay their monthly premium, or the employer if they want to offer it to their employees. But other than that, Methodist donates everything at 100%.
How about the dental and the vision?
That's all done through the Church Health Center. Again, it's resources that the Church Health Center has. The dentists that donate their time, optometrists that donate their time, programs that we have worked out.
And we're talking about top of the line people. I used to think it was an indigent kind of thing and a little embarrassed, ashamed. I'm telling you, you go there, it's top of the line. You don't have to wait forever. You're treated with courtesy and respect and top of the line services. These are the best. I was in awe.
Yeah, all the doctors that our entire office uses are Memphis Plan doctors. We wouldn't recommend our services to anybody that we don't personally know ourselves. Yes.
Yeah, I was part of that Memphis Plan Church Health, and it is very good. Me and my daughter, dental, medical, just everything. I mean, like the pastor said, it's very top of the line. I remember I went in one day, and it's just a testimony. My tooth was hurt so bad, and I just needed it done. Everybody else wanted to charge me arm and leg to pull it. And I went in, because I was connected with them, they put me right in, pulled the tooth, charged me like about $10. And I mean, it's a blessing. And it's a blessing because the people that's involved are Christian-based people who donate their services, you know, to being a blessing to the people that's a part of the program. And it's awesome. I would recommend anybody, if you can get involved and get in it, I would recommend that.
Prescriptions, how are they?
Prescription medication, that's one of the things that are not donated to us. Unfortunately, we don't have pharmaceutical companies lining up to throw free medication at us. We do have a program with Methodist Outpatient Pharmacy that's located on Union, and what you would do is take your prescription to that pharmacy along with your proof of income, and you register for their program, and you get your medication sliding scale based on your income. Yes?
So who is taking care of the unemployed, for one, and then when he was talking about if you were staffer at the church, but there's some people who work at the church, let's say 10 hours a week, who may not get paid at all. So what options are there for those two types of individuals as far as program goes?
With the Memphis Plan, one of the things that we have found are that there are those people that are unemployed as far as reporting to a Monday through Friday 8 to 5 job. They may be house sitting, they may be pet sitting, they may be dog walking, they may be doing something to bring in some sort of income. And as long as an individual will write that person, I mean, even if they get paid in cash, as long as an individual will write that personal letter that says, yes, they work for me, they mow my yard once a week, then we'll find a way to put them on the Memphis Plan. For those that are unemployed, there's always the Church Health Center walk-in clinic. We seem to have better luck with people coming in through the walk-in clinic and using the clinic as a whole and trying to keep people out of the emergency room. And we've been very successful with that. So,
but I'm saying some people are like volunteering their time at church because right now they just happen to be out of work. So technically they're doing stuff at church, but they're not getting paid.
As long as they can come up with the $50 a month for the premium, and someone will say, yes, they are working here, then that's all we need for the Memphis Plan Direct.
Now what about this?
And we only have a covenant agreement with the senior pastor and staff ministers that are full-time paid ministers.
They have to be full-time paid, don't have to.
If I could, it is 1:30 and we always like to be respectful of your time. So if there's anyone that needs to go, please do. If there's more questions, though, we don't want to leave questions unasked or unanswered. I will say this, though, in the ministry that I deal with on a regular basis, we deal with a lot of people that have no income and they have no insurance. And one of the partners that was on one of the slides was Christ Community. And if you have someone that has no insurance and they need medical care, I've dealt with Christ Community over quite a few years. The care is good, the quality of care is good, and my own mom was on the plane at Christ Community right after she retired. So if they go to Christ Community, they can get health care.
Group is that I'm on the leadership team of the Mission of Mercy, which will be coming to Memphis in 2016, and we will need all of you to get involved with that. Mission of Mercy is a free dental clinic And I went 2 weeks ago to Arkansas to see how they did theirs, and it's amazing. They saw 1,000 patients a day. And we expect to do the same thing in Memphis in February 2016. See 2,000 patients here in Memphis. So we need all volunteers, all churches to be involved. So let's go to the Lord in prayer. Well, Jesus, I thank you that your mission in coming to this earth was to heal the brokenhearted, to preach the gospel, but also to heal. And I thank you for these that have a heart for healing. And I just pray a blessing over what they're doing. I thank you for what they're doing. I pray that you will multiply their ministry and help them to help others and spread the healing power of the gospel all through Memphis and beyond. I thank you for these great statistics that show that being involved in a community of love and faith really just helps people to get well faster, and that's just the power of the gospel moving through the community. So we just thank you for this time together. I pray for that people were helped by learning this stuff today, and that they will take action on what they've heard. And we just ask your blessing until we meet again. Bless the people that let us meet here in this lovely facility and fix this delicious food, and just ask a blessing on each person that took time out of their day to come here. In the mighty name of Jesus, amen.
Hey, listen, now I wanted to make this announcement after 1:30, so y'all won't say we kept you long. But anybody that wants to get yourself certified or a pastor certified in marriage counseling, I do that. We charge $175 for that class. Pastors in the network, I'll certify you for free. My next class is this Thursday, though, at 11 a.m. So if you want to get certified,
I heard you singing. I heard you.